A warm welcome to today's talk, Sunday the 13th of August. Now, I want to think about the nature of human life and existence today. And what's brought this to mind is two things, a report from Canada and a report from Australia. Now, I want to start off with a report from Canada first, because euthanasia is becoming increasingly prevalent in Canada. So that's the first thing I want to look at today. Now, this is the second annual report on medically assisted dying in Canada 2020. This is directly from the Government of Canada, so this is all completely authorised, genuine data. So this is the second report based on these regulations here. Check it out for yourself. I always provide the links. Now, there's been agreement on this data, so significant collaboration between federal, provincial, territories between the practitioners. So this is, as far as we know, this is good quality data that we're talking about here, although the numbers are rather hard to believe. The number of medically assisted deaths continues to increase in 2020, and we'll be giving more up-to-date data in a minute. But in 2020, there were 7,595 cases of MAID, medical assistance in dying. So MAD would just be medical assistance dying, so I suppose it's reasonable to put the I in there. Medical assistance in dying, 2.5% of all deaths in Canada. So this 7,595 deaths through medically assisted deaths in Canada represents 2.5% of all the deaths in Canada in 2020. The number of cases of MAID, I suppose MAID does sound a lot better than MAD, doesn't it? MAID sounds like someone who's kind of serving you. The number of cases of MAID in 2020 represented a growth of 34% over 2019. So this is increasing in prevalence. All provinces experienced a steady growth over the year during 2020. So this is all over Canada. Total number of medically assisted deaths reported in Canada since the enactment of the federal legislation in mid-16, 21,589. And as we know from other studies of excess deaths and COVID and things like that, Canada can be quite tardy with data, although we will have some slightly more up-to-date data. But this is interesting for the profiles as well. Men slightly more than women. Average age was 75.3 years. Cancer was 69.1% of cases. Chronic respiratory diseases was 11.3. Neurological conditions, 10.2. So there was cardiovascular diseases there as well somewhere. Anyway, the majority of MAID recipients received palliative care and disability support services. 88.5 were reported to have access to these services when they wished. Now, to me, this means 11.5 weren't. And this is the tone of the report in Canada. It does sound very positive. So they don't say 11.5% of the people that opted to end their own lives prematurely were unable to access palliative services. Everything's phrased positively, which is a bit concerning. It would have been better to have a more balanced report, which of course we're trying to add balance now. 43.6 of MAID recipients were reported as requiring disability support services. Relatively small number. I would have expected it to be higher than that. Primary care physicians remain the principal MAID providers, but the administration of MAID has shifted to be home-based settings. 1,345 practitioners in Canada have been involved in 2020. Mostly physicians, some were nurse practitioners, and some were family doctors, general practitioners, I suppose. Now, the most commonly cited intolerable physical or psychological suffering, loss of the ability to engage in meaningful activities was the reason given by 84.9%, and loss of ability to perform activities of daily living, 81.7%. Now, I did find this interesting. I was expecting intractable pain to be pretty well near the top, although we are actually pretty good at managing that in the United Kingdom, for example. We have hospice services, hospice nurses, Macmillan nurses, who are remarkably good at this sort of thing. So loss of the ability to engage in meaningful activities Now, there's a profession that helps with this. It's called occupational therapy, but they weren't mentioned. Loss of ability to perform activities of daily living, 81.7%. The whole nursing, caring profession can help with loss of activities of ability to perform activities of daily living. But that's not taken into account, which was concerning, the apparently partisan way that this report was written, in my view. The Honourable Patty Hajdu, Minister of Health. As Minister of Health, I am proud to present Health Canada's second annual report on medical assisted dying in 2020. So, the Minister of Health is proud. Okay, interesting turn of phrase. Now, the Superior Court of Quebec, September 19 ruling, struck down the idea that a person's natural death must be reasonably foreseeable. So before this, you had to say, well, this person's probably going to die anyway in the next, I don't know what the time frame was, days, weeks, months. So this can be accelerated to prevent suffering, but that's gone now. That was struck down. The death does not need to be foreseeable. In other words, this now applies to people with non-terminal conditions. The third report, covering 2021, which I think is the most up-to-date we have from Canada, 10,400 to 10,064, it had gone up. Provisions, it says provisions, I guess they mean deaths, accounting for 3.3% of all deaths in Canada, has gone up another 32.4% since 2020. All provinces. So the numbers are increasing. Now, just a quick report on this from the Lancet. Now, this is a Lancet article, as we see, from September 2022. This is Trudeau Lemmings, Health Law Specialist, University of Toronto, says this. What was originally conceived as an exceptional practice in medicine has quickly become normalised. Sounds quite ominous, really. He goes on to say, and again, this is from the Lancet, even before the law is set to be expanded to include mentally ill patients, we already have a worryingly high number of people dying. He argues that Canada's approach is far more permissive than comparator nations, including Belgium and the Netherlands. Switzerland's not mentioned, but that's what they tell us. We have failed to sufficiently safeguard against the medicalisation of ageing. Now, this is one of the concerning things. Medicalising the very young and the elderly. Being young is not a medical condition. Being old is not a medical condition. It's part of what we call the lifespan continuum. And the Lancet also report, the new law enacted last year stipulates that starting in March 2023, MAID will be expanded to include patients with mental illnesses. Now, I understand, if you're in Canada, do let me know. You'll be more up to date than me. This is just data from the Lancet and the Government of Canada. But the first death is not expected till March 2024. So this has kind of been, I guess you can apply on that time and get it on that time. I'm not sure. But I don't think anyone's died for mental illness reasons yet in Canada, but by assisted suicide. First one should be in March 2024. Now, this is also somewhat concerning because English law says that people commit suicide when the balance of their mind is disturbed. You know, if you walk to the edge of a cliff, there's nothing that you want less than to jump off it. You recoil of the danger. People commit suicide when the balance of their mind is disturbed. And this is something I've got a lot of experience with. I've dealt with a lot of attempted suicides and indeed successful suicides. Some remarkably unpleasant, and the patients were severely mentally ill at the time. The balance of their mind was disturbed. And we have a treatment for mental illness. It's called psychiatry. Now, looking at the other end of life, let's look at this very concerning report from Australia.
Well, speaking of outrageous, a Senate hearing in Canberra today was told that 700 babies were born alive after failed abortions between 2010 and 2020. That's just in Victoria and Queensland. Those figures were taken from Queensland Health and from Victoria's Consultative Council on Obstetrics and Pediatric Mortality and Morbidity. And those figures, 700 babies born alive after surviving an abortion but then just left to die, should be a national scandal. At present, abortion providers aren't required to do anything to help a baby that survives an abortion. They're simply left there and time of death is eventually recorded. Well, three politicians, Liberal Senators Alex Antic, Matt Canavan and United Australia Party Senator Ralph Babet, have brought a bill that would require abortion providers to treat a human being who survives an abortion like a human being and actually render assistance. This bill does not restrict a woman's right to an abortion. It doesn't criminalise a woman for having an abortion. It simply requires medical practitioners to render medical care to a human being who's born as a result of an abortion as if they were born any other way. Liz, I was looking at some of the submissions, and as you can imagine, lots of churches have made submissions in favour of this bill. Those opposed to the bill, pro-choice groups, their two main arguments seem to be, one, that this is a private matter. If a baby is born alive during an abortion, well, it's a private matter what happens to that baby between the mum and the abortion provider. And the other argument against the bill seems to be that, well, it's a burden to place this responsibility on abortion providers, that they would have to render life-saving care to a human being. This should be a huge story. It's quite incredible that it's not.
It should be a huge story. Now, I can't believe that anyone would oppose this bill. If the baby's made it, it's arrived. And when you consider how long the wait list is for adoptions in this country, the amount of homes that are desperately wanting a baby to love and take care of, this would not be an imposition. This would be an incredible blessing for so many. And this has been going on for more years than we know. The stats that you've just quoted are between 2010 to 2020.
Correct.
I remember working for Honourable Nick Garan in WA. He put a massive petition together in 2018 it was, and he was pursuing the case of 27 babies born alive, had survived an abortion, and they too were left to die. This has been raised in successive years now, but our government seem to have absolutely no problem with committing what is, I don't care what anyone says, is absolute murder.
And it's not just governments, but Caleb, I've got a friend who's a journalist, I won't say which network, but he wanted to run a story on this very subject a couple of years ago and was told in very plain terms from editorial, no, we don't want to know about it.
Which is the entire antithesis of journalism, isn't it?
Exactly.
It's raising
Indeed.
a tough question and talking about uncomfortable things. And I mean, the latest numbers, 2021 to 22, 192 children were adopted in this country. In the entire country, a country of what, 26, 27 million people, 192 children were adopted. No one's saying that these babies, if an abortion fails, have to be foisted upon the mother. They can be taken and adopted out. Why we don't do that is...
We adopted children from Africa because we were told to adopt an Australian child, you'll be waiting at least 10 years. There's a lot of people who would adopt these babies rather than just have them left to die.
Absolutely.
Incredible.
Well, I don't know what to say to that, really. Quite incredible. Is a civilization, the level of civilization, can we judge that by how we look after our most vulnerable members? Yeah, I would have thought so. Is there a time in all our lives when we are vulnerable and completely dependent on others? Yeah, that's going to be true for absolutely all of us. So maybe we need to think more about how important human beings are, the uniqueness of human individuals and the sanctity of human life. Or just stop pretending to be civilized. Let's just admit we're barbarians. I'll leave it there. Thank you for watching.